Alrighty. So today I have the pleasure of introducing Dr. Mark Leiber, who is an internal medicine resident physician at Johns Hopkins Bayview Medical Center in Baltimore, Maryland, who I'll hopefully be visiting next month. And he's a recent graduate from the University of California, Irvine School of Medicine, Zot. Mark was previously on staff at National Geographic Television, where he worked as an associate producer for 4 years before transitioning into medicine. Mark has also worked for Partners in Health in Malawi as a health systems coordinator and has written over 50 health-related articles for CNN Health as a Stanford Global Health and Media Fellow. He plans to focus his medical career on HIV and LGBTQ primary care. Welcome, Mark.
Thank you, guys. So it's a pleasure to meet you all and to be part of this. I partook, I think that's a word. I partook in the advanced healthcare policy elective last year, and it was awesome. And so I'm so excited to be able to contribute to it this year. I'm going to share my screen. I think that's probably the best way to go, right? Okay. All right, and let me know, are you guys seeing a PowerPoint presentation?
Yep, everything's up.
Cool. Okay. All right. So I'll just go ahead and get started. So this is my first time kind of giving a lecture on this topic. So definitely feel free to give me feedback on kind of things to include or take out, or this is sort of a first time for me to be kind of lecturing on this topic. But it's something that is really important to me, and it's kind of been guiding a lot of my career. And I think it's really important that other healthcare providers get some background into how to sort of engage with the media and use media outlets to help increase health education and health promotion. So kind of as Reese mentioned, so I was a UCI grad last year, and I'm now out in Bayview I'm on the primary care track out here in internal medicine, hoping to do HIV transgender primary care ultimately. So let's see. So I'm starting off just with this this quote. So Sanjay Gupta is someone I sort of look up to, and he's sort of a role model for me in a lot of ways. So he recently wrote a book, and sort of in it he talked a little bit about kind of the sort of beauty that happens when you combine different fields. And I think that's a big part of what has guided me towards this area also. And in our case, I think combining media and medicine, that's really where a lot of the magic happens, is when you start to combine different fields and see how they interact and find opportunities. But I think for other people, I think just combining your interests is really important, and will also kind of help you get through medical school and training and not burn out, to try to find different ways to combine your different interests. So I guess I'll go a little bit into my background before getting into kind of the didactic part of the talk. So kind of as Reese mentioned, I started off sort of working in documentary film and TV production before eventually transitioning into medicine. And a lot of people kind of ask me like why I made that transition, or how I transitioned. And a lot of it was kind of just taking it year by year and kind of following my gut into what was sort of what was guiding me and what was feeling fulfilling at the time. So I kind of originally graduated college wanting to basically, I majored in film and biology and wanted to use film essentially to educate people about health. That was kind of my big guiding principle at that time. That's what got me into documentary film. And then I eventually got a little bit jaded with documentary or TV production specifically, when I originally worked on this series about prisons for a few years, which was fascinating. We kind of would spend like a month at a time in a different prison, following 3 or 4 inmates and kind of telling their story. And that was great. And then that series ended, and then I started working on a different series that was more of a reality TV show, I guess you could say. And I kind of started to feel a little bit just not as engaged, and not as, I felt like my soul was dying a little bit inside. And that's kind of what kind of got me into wanting to do more global health work, and eventually got into medicine. So eventually, kind of had a quarter life crisis, lived abroad for a little while, started doing some global health work, and realized that I really love the clinical side of things, um, and that also combining, media and medicine would be even more satisfying. So kind of getting into the talk, so I guess I'll start off by kind of identifying the problem that I think health communication and medical journalism addresses, which is health illiteracy and misinformation and disinformation, which I think, especially with COVID, is particularly relevant right now. And then I'll kind of go into health communication a little bit, just what that field is. Again, I'm by no means an expert. There are people who have PhDs in health communication, but I can definitely provide my feedback on ways that we as providers can get involved in health communication, and also talk about the different roles that different players and actors can play. Providers being one, but also public health officials, politicians, and other people. Then I'll kind of just introduce some of the tools that I think are useful, especially for people who might not have a ton of experience in media production, in terms of how to kind of get their voices out there. And then I'll just sort of introduce some of the different opportunities for medical students and residents and other providers for getting into this field. So the problem. So I think the big thing with health communication is health illiteracy. I think it's always shocking being in the clinic and talking to patients and really realizing that some of the things that we say we think they understand, or we think is fairly easy to absorb, and often it's not, and often patients go away with a different understanding of what we might be recommending or talking about. I think this was just an old sort of study in 2006 showing different levels of health literacy in the US, showing that only about 12% of people in the US have proficient health literacy, meaning that they are able to navigate the healthcare system well and understand health insurance well, and things that I think a lot of us might not even necessarily. I certainly have problems with navigating health insurance still. So I think generally there's health illiteracy is still a big issue. And then you get down to the lower 14 to 20% of people who basically are able to identify when their next appointment is, but can't even necessarily identify what the dosages are and their medications and what their medications are for necessarily. And so there's definitely just a lot of illiteracy out there, and when it comes to medicine. And this is just a CDC sort of public service announcement kind of showing some of the effects of health illiteracy on our healthcare system. I think the big thing is that it results in a ton of unnecessary emergency room visits, which is not only expensive to the healthcare system, but it also results in decreased quality of care, perhaps for people who might need to be in the ER, and might not necessarily see a provider for a longer period of time just because of how crowded they can get. And as a result of health illiteracy, also, it increases hospital stays because people often come in sicker, perhaps than they would have otherwise. It also causes patients to be less likely to follow the treatment plans that we discuss, or that are discussed in their meetings with providers, and then ultimately resulting in higher mortality rates. So that's sort of health illiteracy. And now I kind of want to switch into health misinformation and disinformation, which is a whole other ballgame, and I think something that we are all seeing a lot of right now. So kind of the difference between misinformation and disinformation, it's a subtle difference, but an important one, I think. So misinformation is basically the inadvertent spread of misleading information and false information, either on social media or in more traditional avenues of media. And sometimes I think we as providers and well-educated doctors do this sometimes as well. I mean, sometimes we might forward an article that we read the headline and we think, oh, this is something that I agree with, so I'm going to forward this article, and haven't really fully read the entire article, gone through some of the biases. And sometimes I think this is something that I think a lot of us are unfortunately guilty of, myself included. But this is sort of inadvertent. Sometimes we end up doing this. And then there's disinformation, which is a little bit more nefarious, and this is sort of when actors are purposefully trying to spread inaccurate information in order for personal gain, whether it be political actors, or whether it be like, I know QAnon, I think, has been has done some of this, as well as I know the Russian interference in our elections. So this is a little bit more nefarious, and I think this is much less common than misinformation, but still provides a barrier to healthcare providers in terms of trying to get accurate information to our patients. So sort of, I guess I'll start off with just sort of pre-COVID. Even before COVID, this was an issue, and I think a lot of it has to do with kind of where our patients are getting their information from. There was a 2018 study that showed that over, more people are getting their health information. More of our patients are getting their health information from websites than they are from their medical doctors. 53% from websites and 48% from medical doctors, and that nearly 3/4 of Americans use the internet in some capacity to obtain health information. And I think another important thing is sort of who people trust when they do see or read information online or on social media. And I think the important thing here is that the most relevant thing is the person who's sharing the information, not necessarily the original source of the information. So this study showed that people who see an article from a trusted share, like someone that they know personally, maybe a medical provider, but when written from an unknown media source, they're more likely to trust that information than something that's shared from someone that they don't know, but is from a reputable media source. So I think that kind of speaks to how important and the responsibility that we have as providers to really know, to really dig into what we share to make sure that it is accurate, because we are, I would say, often seen as a trusted source. So I don't need to go into all of the different examples of disinformation and misinformation, but these are just three that I found that kind of stuck out to me. We all know some of these. The hydroxychloroquine is 100% effective in treating COVID. That bleach is also a good way to treat COVID. And then this is another one that was from I believe it was the Minister of Information in China, who was talking about how the COVID virus originated in the US. And these are all things that are, very prominent politicians who are spreading information that millions of people are taking in as truth, that really have very, very little, unfortunately, sort of basis in fact. And these are some other examples. I think the most recent one that we all have been seeing is that the COVID vaccine causes blood clots, which again is, there are case reports and there are certainly some examples where this is true, but I think the whole point is the context in which these things are framed in the media, and the fact that even though there are some risks involved, the risks of getting COVID are vastly worse, and I think sometimes that side of things in that context is not included. And this is just a little bit on some of the other misinformation, disinformation things that have been out in the media with COVID. I think miracle cures was a big thing that was in the media just in April, sort of not right at the beginning, but shortly after the beginning of the pandemic. And let me see if this is going to work. It might not. It does. Okay. So I just want to, can you guys, I think you guys can see this. So I'm just going to share kind of the first couple minutes of this. It's a PBS NewsHour sort of coverage of the misinformation surrounding COVID.
It turns out that misinformation and conspiracy theories about COVID-19 are rapidly spreading online, creating what public health officials around the world are now calling an infodemic. John Yang charts the dangerous course of falsehoods during this global health crisis.
Eating this can help prevent infection of the coronavirus.
Around the world, journalists find themselves debunking wild claims, miracle cures, and prevention methods.
You need to microwave your mail to kill the COVID-19 virus.
Stories on the origins of the virus.
Is the Wuhan coronavirus a biological weapon? Was it built in a lab by scientists and unleashed on the masses?
Theories about vaccines and billionaire Bill Gates
claiming that he actually created the virus to trick people into getting microchipped.
One particularly persistent falsehood: 5G mobile networks transmit COVID-19.
You know, when they turn this on, it's going to kill everyone. And that's why
A woman in Britain called workers killers for laying 5G fiber optic cables.
when they turn that switch on, bye-bye mama.
Across the United Kingdom, arsonists have burned cell towers, and the claim has been shared online with millions around the world.
The 5G story is complete and utter rubbish. It's nonsense. It's the worst kind of fake news. The reality is that the mobile phone networks are absolutely critical.
It's a nonstop hurricane of misinformation and disinformation to debunk.
Doreen Marchioni is managing editor of Snopes.com. It's a fact-checking website, and it's been inundated with tens of thousands of requests for the truth about coronavirus claims.
One of the dumbest that I encountered was if you stick your face in a hot hair dryer, hold a hair dryer to your face, you might blow COVID out of your system. Tonic water, if you drink a lot of it, will cure you. No, it won't. But it's good in gin and tonics.
Okay, I'll kind of leave it there because I agree that it's good in gin and tonics.
It turns out.
Okay, so that's kind of an introduction to what I see is one of the big problems right now that I think we are facing as medical providers. So now I'll kind of get into health communication, which I think is one of the big tools that we have to combat a lot of this health illiteracy and misinformation. So health communication is kind of the study and practice of promoting health information to patients, whether it be through public health campaigns, through health education, or just through the interpersonal discussions that we have between patients and doctors. And ultimately, the goal, as I mentioned, is to increase health literacy. And I think one of the big things is kind of to understand kind of what the appropriate channels are for our patients. You know, whether it be face-to-face interactions for some of our patients, whether it be TV, public service announcements, whether it be for if we're trying to target a younger demographic through social media, things like that are very important. And I think just to kind of mention this point again, I think we as providers have a lot of responsibility, having now gone through. I know you all have now gone through 4 years of strenuous training and have a much better understanding of a lot of the issues that our patients are facing. And I think it's, as sort of Aristotle talked about, how the onus of communication falls on those who have access to true and just information. And when it comes to health information, a lot of the times that is physicians. So, and this is kind of a broad landscape of actors in health communication. I won't go into all of them. I think I'll probably just kind of focus on these right here, but just to kind of go over, there's a lot of actors in this field. There's, this is probably more the pharmaceutical companies who are trying to make a profit and are using communication for that reason. And there's also politicians who are using it for lobbying and fundraising and public relations. But I kind of want to focus more over here, which is behavior change, public service announcements through public health agencies, and then patient education, and also a little bit about continuing medical education and using communication tools to improve medical education, both here and also in other countries. So I'll just briefly play this. So I think this is an example more, I would say, of sort of medical professional education. And this was the CDC produced this to sort of discuss or to sort of get messages to nursing staff who are working in nursing homes about ways to prevent COVID transmission.
Hi, my name is Kara Jacobs-Lipka. I'm a medical officer and part of the CDC COVID-19 response in long-term care facilities. Today, we're going to talk about how to keep COVID-19 out and the importance of not working when you are sick. This is part of the key COVID-19 prevention messages for frontline long-term care staff. The number one thing that you can do to keep COVID-19 out of your building and keep your residents safe: do not work when you are sick. The virus causing COVID-19 spreads mainly from person to person when they cough, talk, or sneeze. But some people can spread the virus even without having symptoms. So you should wear a face mask while you are at work all of the time. This is called source control because the face mask prevents germs from your mouth and nose from spreading to other people when you talk, cough, or sneeze, which protects residents and staff. CDC recommends the use of cloth face coverings for everyone who goes to public places for source control. These may be able to be used by some nursing home staff who are not interacting with residents. However, cloth face coverings are not considered personal protective equipment and should not be worn instead of a respirator or face mask if more than source control is required, like when you're caring for a resident. What we have seen so far during the outbreak is that COVID-19 enters into long-term care facilities through the people who work there. You could spread germs to residents and patients without even knowing it. And the added benefit of face masks is that they also protect you from germs by keeping germs from touching your mouth and your nose.
All right. So, and we don't need to watch the entire thing. I just wanted to give you guys kind of a look at some
Hi, my name is
kind of what's out there in terms of ways that different actors are educating and promoting health behaviors. So, so now I kind of want to go into, I guess, shift a little bit into what we can do, after talking about some of the actors out there. So I guess one is that in terms of battling health information, a lot of it depends on, in terms of what we do, it depends on who we're talking about. When it comes to medical providers like us, I think a lot of it has to do with sharing information, and kind of, as I mentioned before, making sure that that what we're sharing is accurate, because people are looking to us to share. They often take what we are saying truthfully or as truth. So one is the WHO tips for combating misinformation, which is basically one, assessing your source, making sure that you've read the full article of what you are sharing, and then also making sure that the data is accurate, making sure that that you've kind of gone and thought about some of the biases inherent in the author and who this is coming from. And then also for public health officials, which might not necessarily apply to all of us, but sort of understanding your community and understanding what are the best ways to reach that community. Whether it be through, and if you're in another country, sometimes radio is the best way. If you're trying to have a message or for a younger demographic, as I mentioned, social media would be better. And then also there's these six CERC principles, which public health information officers often use to make sure that what they're saying is accurate. And one is to be first, to be right, to be credible, to express empathy, and to show respect and promote action. And then the other people, other people who are involved in this, one is journalists and social media influencers. As I mentioned, independently fact check everything that you share. For journalists, use your local public health officers and officials to share information, make sure that your information is accurate and up to date. And then for social media influencers, like people who are Instagram influencers, being transparent about what your sources are. I know a lot of people who sort of advertise products and often are not very transparent about what they're getting in return for advertising these products. And then some interesting kind of also advice for the general public is to not share, if you see something that is clearly misinformation or disinformation, not to share it and comment on it, because that'll actually increase the number of hits. And just based on the algorithm, it'll end up coming up more and more in other people's feeds. So if you see something out there that is clearly inaccurate, the best thing is really to not engage in it and not share it. So now I'll kind of get into a little bit some of the tools that we can use and that I've sort of learned to use recently to engage. So one is op-eds, and this is something that I think as medical providers is sorely needed for more of us to be writing op-eds and to have our opinions sort of be out there. And it's really not rocket science in terms of how to write one. A lot of it is kind of based on the five act, 5-paragraph model of writing essays that we all kind of learned in high school. I think that the most important thing is a hook of, why now? Why am I writing about this topic now? And some of it can be the timing. I'll get into an op-ed in a second about the VA system that was written, right around Veterans Day, and the hook was it's Veterans Day, and that's why we're talking about it now. But there are, it's just important when you do, just in terms of the logistics of how you do it, you basically after you've written it, you just email it to you. Most newspapers or TV stations have like an op-ed email address that you just email it to them. They'll get back to you within a few days if they're interested, and then they kind of work with an editor to finalize the piece. But again, the structure is usually fairly straightforward. You have a hook at the beginning, have a nut graph, which is kind of a journalism term, which is just sort of under your lead that talks about kind of what your overarching point is. And then you flesh out what the problem is, what your presumed or solution is going to be, and then just discuss or at least identify or address the other side, the counter argument, as you might say, and then kind of just a summary at the end. And this is just a couple of examples. I think I sent Kelly some to also share with the group. But this is one that a good friend of mine wrote about the VA system. She works at the VA and was sort of getting frustrated with how much negative coverage there was of the VA system in the news. So she sort of around Veterans Day kind of wrote her perspective on what she sees as a lot of the positives about the VA system and health coverage through the VA system. And then this is another one by Richard Besser, who is a sort of also a medical journalist, who wrote about how the kind of used the COVID pandemic as a way of discussing a lot of the weaknesses in our health insurance system and lack of coverage for certain populations. But then, that's kind of the more traditional route of engaging with the community. But then there are also other ways. And one is something that is just engaging with your community just by being out there, really. I know that the residency program that I'm in is very, right now it's difficult in COVID, but usually we are very sort of involved with our community. We often go to churches and talk about health topics. And then we recently went to a long-term inpatient psych unit to talk about the COVID vaccine and to discuss reservations that people might have about the COVID vaccine. So a lot of it is just kind of getting out there and engaging with your community, which I know a lot of times is difficult because we spend so much time in the hospital, but I think it's really important to be out there and have a face in the community. And then also just to get to know your local public health officials, because they are a great resource, both as a source of information for us and also as a way of getting information out to the public. So I know this is the OC healthcare agency would be someone if you're staying in Orange County to just get to know, and I'm sure they have a public health or public information officer who could be a great resource for information. And then in terms of kind of social media use, I mean, a lot of this are things that I think are pretty self-explanatory, but one, make sure to respect HIPAA. Don't disclose any personal health information about patients. Try to avoid sort of giving medical advice to people who might be sort of engaging with your messages on social media, because they're not your patients necessarily. So try to avoid giving specific medical information to people through social media. Identify yourself. Be very transparent about your biases and where you're coming from. And then again, only make sure to be very, very diligent about vetting what the information that you're sharing and making sure that it's coming from a credible source. And then these are some other sort of resources. I know one, which I'm hoping to partake in at some point in the next few years, is Harvard has a writing program that you can do remotely. It's kind of like 2 workshops throughout the year. One of them is basically focused more on it's like 2-week workshops. One is more focused on like op-eds and engaging with the public, and the other one is more writing for for health journals and also for doing things like public grants and proposals. So that's something that I think could be a resource if you haven't had that experience and would like to get just kind of an introduction. And then the other is, I'll talk about a little bit more, but one is just getting some throughout residency and medical school. You can do internships working in the health units of different media organizations, just to get some exposure and experience to see how they choose different stories to cover, and kind of what their process is for covering stories and getting information out there. So, so kind of as I mentioned, so in terms of opportunities for you as doctors and medical students, so one would be through the ABC News. They do have, I think it's a 4-week elective that you can do either in medical school or residency. I have a resident here who just finished one, who just finished doing it a couple of weeks ago, actually. And SiriusXM also has electives that you can do. I don't know if they're still doing it, but they were doing it for a few years, sort of doing radio pieces on health topics. And then also the Alan Alda Center in Stony Brook in New York also is very invested in sharing sort of research findings with the public. And then another one, which is what I did between my second and third years of med school, is this Global Health and Media Fellowship at Stanford, which basically trains. It's a 1-year program that you spend half the year basically getting training in journalism techniques and journalism skills, and then you spend another 6 months sort of embedded in a health unit at a different media organization doing coverage of health news. So I'll kind of just briefly go into sort of this experience. So again, this was sort of between second and third years of medical school, and kind of the first part was we were auditing the journalism classes at Stanford, just learning kind of the basic techniques and philosophies of good journalism. Sort of the guiding principles right here, sort of NPR's guiding principles are accuracy, fairness, completeness, independence, impartiality, and transparency. And this is, I think these things are kind of what differentiates journalism from advocacy, because I know that line can get blurred a lot. And I think it's really important to kind of know when what you're doing is advocacy and which can be coming from obviously a very good place, but that's different than journalism, which often you want to show both sides of a story, and you want to really be very complete and fair with your coverage. And the tools that we kind of learned to use during this part of the fellowship, I know it was a kind of very humbling to see a lot of the stories that were being covered. We weren't using like super fancy cameras and audio equipment. A lot of the times we were just using our phone. We would just had different apps on our phones that we were using to record interviews that we did. One of them was called Tape a Call. Well, that's more if you're on the phone and want to be able to transcribe or remember quotes later. And then there's just like audio recorders that we would use on our phone. And then for audio and video editing, we would often use Final Cut. Audacity is another software that we would use sometimes for audio editing. Let's see here. And then this was kind of the final project that, at least for my time there, was about kind of going off of my interest in prison health. We did a piece on in Santa Clara County. They had a program that was basically connecting people who had recently been released from prison with a primary care provider. It was funded through the public health, through the county's public health agency. And so I just did a little piece sort of talking with some of the providers who were part of the program, and some of the beneficiaries of the program as well, about kind of the importance and some of the barriers that some of them faced when they were released from incarceration. And then the second part was sort of working in a health or in a media organization. So the year that I did it, it was at CNN, and basically the main part was you sort of were embedded with this team of about 10 to 15 health journalists. Interestingly, only one or two really only one or two were practicing physicians. The vast majority, some came from public health backgrounds, some didn't really have any formal training in medicine or health, but have sort of been working in the field for so long that they have sort of had on the ground training. And sort of what we did, I would say my major role was writing stories about new research, new like health research that was coming out in JAMA or the New England Journal. We would sort of get together as a group every week and sort of go over that. The media organizations have access to sort of what's going to be published the following week. in these journals. And so we would sort of go over a lot of the research studies that were about to be published to discuss, what was potentially going to be the most relevant or the most important, or what our audience would want to hear about, essentially. And so we would then assign different writers to cover different research articles, and then we would talk to the author, talk to an outside expert, and write a little piece on it. And then more recently, I know Reese was there when I was doing this. Last year at about this time was right at the beginning of COVID, and I kind of also did a little bit of work with them, just doing some basically fact checking on COVID for TV, because they were vastly under resourced in terms of covering a pandemic. That was not what they were set up to do. So, and these were two of the articles that I wrote during that year. One was about, I just thought it was very interesting that there was an article that came out about pregnancy complications potentially being a risk factor for schizophrenia in certain people. So kind of did a piece on schizophrenia, what it is. Anderson Cooper did a little video on it, and then we kind of just sort of delved into some of the research, looking at some of these less traditional risk factors for schizophrenia. And then the other one, which I hope no one's offended by me including it, is this one where basically someone had written to us that he had this experience where he broke his penis during sex and thought that it was something that needed to be discussed with publicly, because it is apparently more common than people know. And so we ended up deciding to write a story on it. He also wrote a book about it, so that kind of helped as well. But I think just kind of what I came away from that experience was that was a lot of just telling a good story. There was obviously a good story there, but a lot of it was just kind of being, telling a good narrative and then using that as a way to get important health information to people. And there really was, interestingly, a lot of good health information in there that was kind of surprising to, I think, a lot of us. And then the last part, let's see, okay. And then the last part of the fellowship was also kind of taking a lot of what we learned during the time, both at Stanford and also at CNN, and taking it abroad and trying to use it with public health agencies and public health officials to improve coverage of health issues internationally. And I think this was the perhaps most fulfilling part of this, because there's just so much that you could do. I think that the year I did it, I went to Laos to work with this organization called Health Frontiers, which is an American NGO that basically worked with the state medical institutions to train residents in internal medicine, emergency medicine, and pediatrics. And kind of when I got there, they basically were just essentially like, you have some background in media. We would love you to either train us on how to improve our medical education videos, or to produce public service announcements about certain outbreaks and prevention strategies. So there was just a ton of opportunities and a ton of ways to kind of use media to help guide their missions as well, and help contribute. So I would say I spent a lot of time producing videos that were more medical education based. So one was, we did a series of physical exam videos for the pediatric residents and I'll share just a clip in a second, that basically, they didn't have any physical exam videos in Lao, in the language of Lao, explaining physical exams. And so they would often be relying on videos from the US or from other countries that weren't necessarily in their native language. And there was just a huge unmet need there for education for providers. And then another thing that we did is they also were, the EM residency program wanted to improve their ultrasound education, and coming from UCI, I was like, oh, amazing. So I talked to Dr. Fox, and we translated some of his UCI ultrasound videos into Lao language, which really just required us finding someone who could translate it, and then we just took out Dr. Fox's voice and put in this other voice. And then as a result, where they were able to use that. And then some other things is that we worked with the local WHO office there to produce PSAs on outbreaks that were occurring. The ones that happened when we were there, well, one was about dengue and one was about hepatitis A. So we would just, that's what this picture's from. We would kind of go to this area, the area where the outbreak was occurring, talk to some of the patients who were involved, talk to some of the providers, and then kind of just go through, you know, kind of like a public service announcement, just discuss what are the strategies for preventing dengue or hepatitis A. For hepatitis A, it was mostly, you know, making sure that you cooked your food well and were washing your hands. And for dengue, it was mostly mosquito-borne, you know, prevention. You know, making sure to wear bed nets and drain stagnant water, things like that. So these were all things that we were just that we wanted to make sure that we got these messages across to people. And this is just, I won't again read this entire thing, but or show this entire thing, but this is one of the physical exam videos that we did. And kind of when they first asked us to do this, I was a little skeptical about if it would actually be used or be important. But you know, it's now a couple years out and almost 20,000 views for this, and it's really telling of how much of a need there is in other countries for physical exam videos and other medical education videos that are in their language. So I'll just play a little clip just to give you a sense of what it looked like. If it ever plays.
แทรกแล้วก็สั่งเนาะนอกจากนั้นแมนอาการชีวิตแมนเป็นสิ่งที่สำคัญที่สุดเนาะอาการชีวิตแมนเขาจะต้องเอาให้ครบสุดเป็นต้นแมนอุณหภูมิความดันเลือดกำมะจรอัตราการหายใจรวมทั้งการแทรกออกซิเจน saturation ถ้าหากมีเขาก็ต้องได้เอาบัดนี้การกวดหูแมนเขาจะซองเบิงเจี้ยวหูของเราแมนใสดีเนาะบ่มีซอดบ่มีน้ำหนองหรือน้ำอันใดไหลออกมาบ่มีวัตถุแปลกปลอมหรือว่ามีสัตว์ตัวใดที่อยู่ในหูของเราอันนี้แม่นหูเบื้องขวาถือว่าปกติกวดหูเบื้องซ้ายเส้นเดียว
All right, we don't play the entire thing, but just to give you kind of a taste of what this looked like. So kind of my big takeaways from this sort of experience in medical journalism and health communication. And one is that is kind of, as I mentioned earlier, the line between journalism and advocacy can become very blurred, and that it's important if you're identifying yourself as a journalist or as someone who is you know, if you're showing this information, to make sure to follow some of NPR's guiding principles. I think the big one is just showing both sides of the story, being sure that even if you are, you know, primarily showing one side, to at least introduce or discuss kind of what some of the counter arguments are, and to try to be as objective as possible, which I know is a lot easier said than done. And to be very transparent about some of your biases and where you're coming from. The second thing is just that it's a lot easier now to produce good quality content than it was even 10 years ago. Our iPhones have become essentially as good as professional cameras in terms of resolution and in terms of sound quality. And it's kind of amazing what people can produce now just with their phones. Another thing is building a website. If you do sort of end up doing anything in this area, having like a repository of things that you've produced is really helpful, I think, both professionally in terms of you know, when you apply for things, and also just to increase your credibility and have just just a way for people to kind of see what you've done. And then also, you know, it's not just with media organizations that you can do this. You can also partner with public health organizations. In Laos, we were partnering with the WHO. You can also partner with educational institutions to make like medical videos for educational purposes. You know, there's a lot of ways to use media to promote health that are outside of kind of what we think of traditionally as kind of journalism or you know, media. And then another is just kind of a reminder that a lot of people trust their local institutions more than national or international institutions. I think that's something that we're also seeing a lot more with COVID. And I didn't put in any studies, but there's definitely a lot of studies showing that people trust their local news more than national news, and their local public health institutions more than national public health institutions. So I think it's important, you know, not everyone has to be doing this on a grand national scale. Just getting involved locally is really important, and arguably probably more important than doing this on a grand scale. And that's everything that I had. So I guess I will open it up for questions now. And yeah, thanks for listening.
So I hope everyone feels empowered. You don't have to have finished some beautiful, magical fellowship in order to engage with the media, either as a content creator or just as someone who's engaging. Maybe you engage in an interview, maybe someone decides to record something that you're doing clinically. Maybe you're the conveyor of information to your patient just in an exam room. You are still occupying the same role that Mark was in his journalism, with his journalism hat on. So I hope everyone feels empowered to engage with the media a little bit more confidently now after we have a bit of more of a framework of how you can do that. Chat box is open for any questions. Feedback should be live now too. But thanks, Mark.
Of course.
You did good.
Thanks. I just finished a week of ICU night, so I probably look exhausted.
Is that why we're double fisting coffee and water right now?
Yes, that is exactly why we're double fisting coffee and water at 7 p.m.
Sounds right.
Yeah, but good luck to everyone. And residency is fun, tough but fun. But I feel like I got a great background at UCI, so I think it'll be a great experience for everyone.
Good.